has announced an important step forward in the prevention of HIV in sub-Saharan Africa. Initial results emanating from clinical trials demonstrate that an injection once every 8 weeks is more effective than taking a daily pill to prevent HIV among women. For more on this, I'm joined by Professor Sinead Delany-Moretlwe, who is a clinical epidemiologist and research director of the Wits Reproductive Health and HIV Institute. Prof, good evening and thank you so much for your time. Certainly, a cat's getting my tongue there. So before it digresses even further, let me hand over to you. Tell us about this injection effectively and what it does.
Yeah, so this was a study to evaluate a new drug called cabotegravir. And to see whether providing an injection of cabotegravir 8 weekly was more effective in preventing HIV in women than daily oral PrEP, which is currently what's available. And what we showed is that cabotegravir prevented about 9 times more infections than Truvada, but the overall rate of infections in all women in the trial was incredibly low, suggesting that both of these products are incredibly effective in preventing HIV. And so it's a very important day for women in HIV prevention, because what this does is identify a new prevention option which overcomes many of the challenges that daily pills have, in that it's a kind of discreet and convenient method that will fit into women's lives and really potentially change the face of the epidemic.
What are some of the things that women have listed as being reasons for why they are not taking the daily PrEP?
So I think the most important thing is that women do want HIV prevention, but what they want are methods that fit into their daily lives, and taking a pill a day is challenging. I think there is just the issues of taking a pill a day and being reminded every day that you're at risk for HIV, but there are also a lot of social pressures associated with taking antiretroviral pills. People suspect that people are living with HIV, and there's a lot of stigma associated with that. People feel that maybe this reflects infidelity in the relationship, and so women may be under the threat of intimate partner violence. And so this is an alternative that overcomes many of those issues by being a safe and discreet method that women can potentially use.
When we talk about this injection, how widely available is it?
So the trial is really the first step in creating access to this product. It was really important for us to demonstrate that it was, in fact, effective in preventing HIV. And now begins the process to obviously submit all the data to regulatory authorities so that they can license the product. And, you know, kind of the company that makes the drug, ViiV Healthcare, is going to begin that process early next year, and maybe they will have responses from regulatory authorities by 2022. But in the meantime, for all those participants who are on study, what we plan to do is communicate these results to them, and to begin with, allow them to know which study group they were allocated to, but hopefully with an amendment, we will then be able to provide them the opportunity, if they wish, to access cabotegravir and to continue in follow-up on the study, so that we can learn more about this product when people use it, when they know which study arm they're on.
Sure. And we'll get to, you know, perhaps explaining the difference. In fact, let's do that now. The difference between the trials you were conducting and what you told those that had, you know, been part of the trial in terms of what they were being given and what they weren't being given.
Yeah, so this is a randomized controlled trial, which is the way we evaluate many new products. And women who joined the trial were interested in having access to PrEP. I think what is important about this trial is that it was one of the first that offered people the opportunity to access one of 2 active products. Although we hadn't proved that cabotegravir was effective, we had a strong belief based on sort of what we've shown that antiretrovirals can be used for pre-exposure prophylaxis to believe that it would be effective. So women were then randomized either to active cabotegravir and a placebo Truvada, or active Truvada and a placebo cabotegravir. And then we followed them up for a period of time, and obviously sort of in terms of the best available prevention services, counseled them about other HIV prevention strategies, and then, you know, kind of assessed what the impact was on HIV incidence in the 2 groups. And so because, just to kind of also remind you that this study was in fact stopped early because we saw such overwhelming benefit for cabotegravir.
If I'm hearing you correctly, it could be a couple of years yet till this injection is available, at least for ordinary members of the public. How long generally do you expect it to take?
So as I mentioned, it might take 12 months, it might take a little bit longer when working with regulatory authorities in countries in the region. I think there's a commitment to also work with WHO to find ways to expedite the regulatory process. And I think everyone recognizes that, you know, kind of HIV, particularly in sub-Saharan Africa and particularly amongst women, is an emergency, and there's a strong desire to fast-track the approvals. But obviously what everyone who is going to use this product, as well as the healthcare providers who are going to dispense it, they need to be confident that, you know, kind of this is effective and it is safe, and that's why we go through these processes to have these data reviewed by regulatory authorities prior to licensure and access.
Professor Sinead, as you come up with, you know, different types of vaccines to try and help people manage HIV infection, what are some of the social aspects that you factor into your research? Because we know that those play an incredible role in terms of the rate of infection that we are seeing in sub-Saharan Africa.
Yeah, you know, kind of, you're quite right. A lot of the reasons why women particularly are vulnerable to HIV are because they haven't had many HIV prevention options within their control, and much of their risk is shaped by the social context in which they live. So, you know, kind of poverty, lack of access to adequate health care, lack of negotiating power within relationships. And these are all important things which I think within trials we do our best to link people to services so that they can maximize their health care. But it's also why we need these biomedical interventions, so that people are able to have interventions that can help them overcome some of the social barriers that make it hard to prevent HIV.
Do you think that with initiatives such as this, we are going to get to a point where we're completely turning the tide in terms of the infection rate, especially among young adolescent women in sub-Saharan Africa, which seems to me to be where you know, the other big problem is emerging?
Certainly. You know, there are a couple of parts to that question. So we do think this is an incredibly important addition to HIV prevention for women. And the fact that we saw an incidence rate of 0.21% in the cabotegravir arm tells us that this is a very effective product. We do have to do more work to understand the safety and acceptability in younger populations, and that's certainly part of our research agenda. But ultimately what we need are a range of HIV prevention options that can be used by women throughout their life course, and, you know, kind of also during periods of pregnancy and breastfeeding, and that's additional work that also needs to be done. But if we're able to kind of demonstrate that these products are useful during those periods, certainly it will make a very big difference to HIV prevention in the region.
Professor Sinead Delany-Moretlwe, thank you so much for your time. And she is an epidemiologist. I'm struggling with that word tonight. An associate professor and director of research at Wits RHI. Well, thank you for your time on News at Prime. Well, the trial of the man accused of murdering